As we continue with our podcast, our next guest is Dr. Lesley Ogden, CEO, Samaritan North Lincoln Hospital and Pacific Community Hospital in Newport. Welcome.
Thank you.
This is an interesting time for you at Samaritan North Lincoln and Pacific Communities Hospital because you've got a lot of things going on.
We never have a time when we're not working on something.
Something new, something different. Pharmacy is the one that I wanted to get to right off the top of the program. You are making a pharmacy at Samaritan North Lincoln Hospital? Or have?
Yes, absolutely. As we saw Bi-Mart Pharmacy close, and then as we got into the pandemic and saw our local pharmacy struggle a bit with trying to figure out their staffing and all of the needs of people throughout the pandemic. We saw additional needs for vaccines. You know, as I said before, you have one less pharmacy in town. How are the others going to pick all of this up? And then workforce issues that we struggle with all across healthcare hit us particularly hard, I think, in the Lincoln City area. So it became really top of our list of care issues. If we are truly wanting to make a difference in patients' lives in this area, that is one of the number one things that we can do to influence good health care.
But it's still not an easy task. I mean, there is a lot that goes into this.
Absolutely. And our first thing was to dream the dream, right? And then the second part of it is to find the expertise to actually execute on that. And I'm very lucky that I had recently come into knowing our new outpatient pharmacy director for the system, and she coincidentally came from Bi-Mart, right? When Bi-Mart shut down a bunch of their different pharmacies, we were smart enough to snap up that talent, and with her expertise over the existing Samaritan outpatient pharmacies that are located in Corvallis and Albany and Lebanon, we asked her, can you do the same thing for us in Lincoln City? And she said, well, I just so happened to have been studying your situation. I knew exactly what was happening as Bi-Mart shut down and as we've seen things not be ideal in the pharmacy world in Lincoln City. And she says, yes, let's sit down and talk about how to make that a reality.
So I will be able to now go to the hospital, see my doctor, and get my prescription in one fell swoop.
In one fell swoop. Now, we can't put it all under the same roof because we do have a space issue there.
There is that.
There is that.
So whereabouts am I going to go?
Yeah, so the administrative building that also has our physical therapy and other therapies on the corner of Northeast 28th and West Devils Lake, that is going to be the new home for the community pharmacy, and it is going to face the hospital. So if you're pulling into the parking lot of the hospital, just turn directly around and look back the other way, and you're going to be framed in by the hospital on the east end of the parking lot, and then we'll see that pharmacy be built in on the west end of that parking lot, actually on the east end of the building.
And the hours of operations will be what, Dr. Ogden?
We anticipate sort of normal pharmacy type hours. We're going to have a drive-through pharmacy, so we'll be building that in.
I'm old. I love it.
Everybody wants convenience, and we're going to provide that. We'll also have a walk-in portion so that you can go in and sit and talk with a pharmacist if you needed to actually get things like vaccinations or other types of things that we'll be providing, because this is going to be a full-service pharmacy from stem to stern. And our auxiliary has gotten in on it, and they have conveniently placed a gift shop.
What a surprise.
That's going to be right adjacent there, so that if you have while you're waiting on a prescription to be filled or things, you can also have some retail shopping that will be right there for you as well.
Speaking of retail shopping, will there be the bottles of aspirin and Band-Aids and all of these type of things that you would traditionally buy at the pharmacy as well?
Correct. correct. Maybe not the same extent because, again, we're not going to have quite the retail aspect that you see, say, in a Walgreens or a Rite Aid or a Safeway, but we're going to get pretty darn close. And our specialty, though, is going to be understanding the patient. And what I mean by that is we will have access to the patient's full medical record. And that is something that a commercial pharmacy it doesn't necessarily have. They just have your prescription that a doctor, or other advanced practice professional sends over. So in that way, our pharmacist will be able to advise patients in ways that maybe you've never had done before. Maybe you've never had that level of service. And that is very much the level of service that we want to give.
Wow. Look forward to it. And you'll be able to take a prescription you receive from a doctor if you've been, say, to OHSU. So it's out of system, if you
Correct.
will. Can I bring that to Samaritan North Lincoln Hospital as well?
Right. Okay. You can. Will be set up to take paper prescriptions, or much more likely they will actually be electronic prescriptions.
Sure.
Right. That will it will be a Samaritan North Lincoln outpatient community pharmacy that people can just pick off a list and it will fly through the ether and come to us.
And I love the name community. Community speaks volumes.
That's our goal.